How to find a heart attack before it happens. Have you ever brushed off a small sensation in your body, thinking it was just due to aging, fatigue, or skipping a meal? A bit of shortness of breath after climbing a few steps, lingering fatigue even without heavy activity, or an unusual wave of nausea after dinner, and then you reassure yourself it's probably nothing. But according to the American Heart Association, nearly half of all first heart attacks happen without clear warning signs. Even worse, many of them are what's called a silent heart attack. No chest pain, no dramatic warning, yet quietly damaging your heart. What's frightening is that most of these warning signals can appear days or even weeks before the heart attack actually strikes. The problem is they're so mild, so vague, that it's easy to overlook them. In this video, I'll show you how to detect a heart attack before it has a chance to hit, by recognizing the subtle signs you might be experiencing right now, and using simple at-home checks that could save your life. And at the end, I'll share one critical moment, the one that can determine your survival chances, that most people completely miss. Most of us picture a heart attack the way movies show it, someone clutching their chest in severe pain, breaking into a sweat, and collapsing. But the truth is, the heart doesn't always sound the alarm so loudly. There's a type of heart attack known among medical professionals as a silent heart attack. It's dangerous because you don't feel the crushing chest pain or sense that you're on the brink of death. You can still walk, work, and talk as if nothing is wrong, while inside, part of your heart muscle is slowly dying from lack of blood supply. Research published in the journal Circulation by the American Heart Association found that about 45% of first heart attacks are silent. The Cleveland Clinic reports the number can range from 20% to 60% depending on the patient group, and it's especially common in older adults, women, and in people with diabetes. The reason is that these groups often have reduced nerve sensitivity or blunted pain signals, so the heart sends distress calls that the brain doesn't interpret as urgent. The scary part is that after a silent heart attack, the risk of dying from cardiovascular disease triples, and the risk of death from any cause rises by more than 30%. Most people who've had one have no idea until it's discovered during a routine heart exam or when a second, often more severe heart attack suddenly strikes. I've seen many cases where people ignored very subtle changes. One woman, 58 from Ohio, living with type 2 diabetes, thought she was just dealing with indigestion and fatigue from caring for her grandchild. It wasn't until she went to the doctor for high blood pressure that a test revealed scar tissue on her heart, a sign of a past heart attack she never knew she had. We tend to dismiss these symptoms because they mimic common effects of aging: tiredness, shortness of breath, insomnia, bloating. But this very confusion is what allows the heart to suffer silent damage. And if you still believe you'll just know when something is wrong with your heart, the next part might change your mind, because I'm going to explain why the body often hides these warnings and why millions of Americans miss them until it's too late. Why so many people miss the signs. We often overlook early warning signs because they don't match the dramatic image of a heart attack we've seen in movies. Instead of crushing chest pain, it might just be an afternoon slump, a bit of breathlessness walking from the living room to the front door, or a vague heaviness in the chest you can't quite describe. For women, the difference is even more striking. Research from the American Heart Association shows that 43% of women who have a heart attack never experience obvious chest pain. Instead, they may feel short of breath, drained, weak, or nauseated, symptoms often blamed on stress, digestion issues, or simply getting older. I remember a patient, a 62-year-old retired teacher from Florida. For 2 weeks, she felt weaker than usual, needing to sit and rest after cleaning the kitchen. She thought it was because she'd been less active and was worn out from caring for her sick husband. One night, she woke at 2 a.m., struggling to breathe, cold sweat soaking her forehead.
Still, she stayed in bed, thinking it was just a momentary flutter. The next morning, during a routine checkup, her ECG revealed she'd had a mild heart attack in her sleep. There are reasons why these signals can be so faint. In people with diabetes, nerve damage can blunt pain, so the discomfort isn't as sharp. In older adults, the circulatory system may have adapted to lower oxygen levels, meaning reduced blood flow to the heart doesn't trigger a strong reaction. And for both men and women, busy lives and other health issues can mask or overshadow small changes. But ignoring the signs doesn't make them disappear. Each time the heart sends out a signal and we don't listen, the muscle loses a little more strength. Over time, it may no longer be able to compensate, until one day, a major heart attack becomes the final warning. We're not going to let it get that far. Right now, let's go through the 7 earliest signs your body might be giving you. Some of them you may have experienced without realizing their importance, but after hearing them, you'll never see them the same way again. Stay with me until the end, because after these 7 signs, I'll share simple at-home tests that can reveal your risk even before any obvious symptoms appear.
7 early signs most people overlook. Persistent fatigue without heavy activity. This isn't the kind of tiredness you feel after exercising or gardening. It's a deep, lingering exhaustion that seeps into even the smallest tasks. You clean the kitchen for a few minutes, fetch the mail, or stand for a short while, and already feel like you need to sit down. Many assume it's just age catching up, but in reality, it can be a sign of reduced blood flow to the heart muscle. According to a study in Circulation, for many patients, this low-level fatigue was the only symptom before a heart attack diagnosis. If you've felt this way for weeks, don't ignore it. 2. Shortness of breath during routine activities. Tasks you used to handle with ease, climbing a few stairs, walking across a room, carrying a light grocery bag, suddenly feel harder. This can signal that the heart is no longer pumping efficiently, leaving the lungs without enough oxygen. People often chalk it up to aging or lack of exercise, but shortness of breath is one of the clearest early warnings of heart trouble, especially in women and those over 50. 3. A feeling of heaviness or pressure in the chest without severe pain. Some describe it as something pressing down, a tightness, or a dull, squeezing discomfort, sometimes even at rest. You don't need crushing pain to take it seriously. In many cases, this is the first signal from partially blocked coronary arteries. 4. Unexplained nausea, bloating, or frequent burping. Many women's heart attacks begin with symptoms that mimic stomach issues. If you feel unusual fullness after a meal, unexplained nausea, or constant burping, especially if paired with fatigue or shortness of breath, consider that it could be heart-related. 5. Mild pain in the back, neck, jaw, or left arm. The discomfort can be dull, fleeting, and unrelated to movement. For women, upper back or neck pain is often mistaken for muscle or joint issues. But if it appears suddenly, without cause, and keeps recurring, it's a red flag. 6. Cold sweats without physical exertion. You're resting or watching TV when sweat suddenly breaks out, especially on the forehead, back, or palms. This can be the body's reaction to heart distress as it tries to regulate temperature. 7. A sense of unease, restlessness, or a gut feeling something is wrong. Many heart attack survivors report that before it happened, they felt a strong, unshakable sense of dread, even without other symptoms. It's a reminder that your body's intuition can sometimes be more accurate than you think. If you recognize one or more of these signs in yourself, don't panic. In the next section, I'll help you figure out whether you're in a high-risk group, and more importantly, I'll show you how your body sends daily warnings so you can respond in time. And remember, at the end of this video,
I'll share 5 simple tests you can do at home that could save your life even if you have no obvious symptoms.
Major risk factors. Recognizing early signs is only half the story. The other half is knowing whether you are in a high-risk category, because it's these silent factors that lay the groundwork for a heart attack. The first is high blood pressure. It's called the silent killer for a reason. It doesn't cause pain, it won't make you faint right away, but every day it forces your heart to work just a little harder, until eventually the heart muscle wears out. After age 50, an ideal blood pressure should be under 130/80, and if it's consistently over 140, you're holding a serious warning sign in your hands. The second is bad cholesterol, especially LDL. When LDL levels are high, fat begins to build up in the artery walls, forming plaques that narrow the blood flow. You won't see it, you won't feel it, but this is the root cause of most heart attacks. Even if your LDL isn't unusually high, if your blood vessels are inflamed, measured by the hsCRP test, the risk is still there. The Jupiter trial proved that using statins in people with high hsCRP, even with normal LDL, significantly reduced cardiovascular events. The third is diabetes and pre-diabetes. Few people realize that diabetics have twice the risk of heart attack compared to non-diabetics. High blood sugar damages blood vessels, weakens the entire circulatory system, and leaves the heart vulnerable. Even if you haven't been diagnosed, if your fasting blood sugar is between 100 and 125, you're already in the risk zone. Next is sedentary lifestyle. Sitting for long hours, moving very little, and not exercising slowly weakens the heart. The good news, you don't have to become an athlete to change this. Walking just 15 to 30 minutes a day can significantly improve heart health. Chronic stress is another major factor. Constant worry, poor sleep, and persistent restlessness raise blood pressure, increase heart rate, and trigger harmful stress hormones. It won't cause a heart attack overnight, but over time, it chips away at your heart's strength. Then there's belly fat, the fat that wraps around your internal organs. Forget the scale. If your waistline exceeds 36 inches, 90 centimeters for men, or 32 inches, 80 centimeters for women, the strain on your heart is already higher. And finally, smoking, even if you've quit. Years of inhaling cigarette smoke narrow blood vessels, cause chronic inflammation, and the damage doesn't disappear overnight when you stop. If you have 3 or more of these risk factors, your heart is sending you a clear message. But that message doesn't only show up in lab numbers. Your body whispers it every day through small signals that, if you know how to listen, reveal exactly where you stand on the path toward a heart attack. Right now, I'll show you those signals. 5 daily reminders your heart sends, sometimes only for a few fleeting seconds, but enough to change your course before it's too late.
5 daily warning signals from your body. Some warnings don't show up on test results or machines. They appear in tiny moments throughout your daily life. If you pay attention, they're like gentle knocks from your heart, reminding you something inside isn't right. One of the clearest signals is an unusual change in your resting heart rate. You're not exercising, you haven't had coffee, you're not stressed, but your pulse is higher than usual, maybe jumping from your normal 60 to 80 or 90. Studies show a resting heart rate of 90 beats per minute or higher can double the risk of death from cardiovascular disease in men and triple it in women. This means your heart is working overtime to make up for reduced blood flow. The second signal, you get winded more easily doing slow, light tasks. Walking from the kitchen to the door makes you stop to catch your breath, or climbing a few stairs leaves your heart pounding, even though these used to be effortless. Many chalk it up to aging, but in truth,
This can be one of the earliest warnings of a weakening heart. The third signal often appears at night. You're asleep, but wake up around 1 or 2 a.m. with a rapid heartbeat, discomfort, or the feeling that lying flat makes you short of breath, forcing you to sit up to breathe easier. Some people experience a silent heart attack in their sleep without realizing it, leaving only ECG traces later. The fourth signal is feeling exhausted at a specific time of day. For example, every afternoon between 2 and 4 p.m., you crash, so tired and sleepy you can't focus. Many blame it on a carb-heavy lunch, but in reality, this may be when your heart is most fatigued, not pumping enough blood to fuel your body. And the fifth signal is a vague change you can't quite name. No pain, no fever, no cough, but you feel low on energy, lose your appetite, feel sluggish, or can't concentrate for long stretches. Many people dismiss it as just getting older, but sometimes it's the final whisper before your heart sends a much louder alarm. If these signals keep showing up, especially over the past week or two, this is no longer something to brush aside. The good news? You don't have to sit and guess whether you're at risk. There are simple checks you can do at home, no fancy machines, no big costs, yet they can give you a clear answer. In the next section, I'll walk you step by step through these 5 home tests, and stay with me, because at the very end, I'll reveal one simple action that could decide whether you survived the first critical minutes of a heart attack.
5 ways to check your heart at home. You don't need to be a doctor or have professional medical equipment to know whether your heart is doing okay. With just a few minutes a day, you can assess potential warning signs yourself. The first is to check your resting heart rate. Sit still, place 2 fingers on your wrist or neck, and count the beats for 1 full minute. If your reading is consistently above 90 while resting, without caffeine, anxiety, or activity, it may mean your heart is working harder than normal to overcome a blockage in the arteries. The second is to measure your blood pressure correctly and at the right times. Don't just check once and feel reassured. Measure in the morning before eating or drinking, and again in the evening before bed, for at least 3 consecutive days. If your readings are often above 140/90, don't wait. This is a clear warning. And don't let a single normal reading fool you if most of the others are high. The third is the 6-minute walk test. Start a timer and walk back and forth, indoors or outdoors, for 6 continuous minutes. If you feel short of breath, dizzy, have chest discomfort, or nausea, stop. Don't assume it's just because you're out of shape. Many studies show your ability to complete this test is closely linked to overall heart health and future heart risk. The fourth is the sit-to-stand test. Stand up and sit down 5 times in a row without using your hands. If you feel dizzy, your heart races abnormally, you have mild chest pain, or you have to stop midway, take note. This simple test measures your heart's stamina and circulation efficiency when changing positions. The last is to observe your body's reaction after a meal. If 15 to 30 minutes after eating a normal meal, you feel unusually sleepy, your heart races, you feel unwell, or have a sudden drop in energy, it's not just eating too much. It could mean your heart is struggling to supply enough blood to both the digestive system and the rest of your body at the same time. These tests don't replace a doctor's exam, but they give you something valuable: control. You'll know when it's time to book an appointment, and you'll have clear data to help your doctor assess your condition more quickly. But even if everything seems fine, it doesn't mean you're completely safe.
I've seen patients with normal blood pressure and steady heart rates who were hospitalized with a heart attack just days later.
Why regular checkups aren't enough. Regular health checkups are essential, but they're not a foolproof shield against a heart attack. There are things even the best doctor can't detect in the brief time you're in the exam room. They don't live with you to notice that you're more tired today than yesterday, that you've been climbing stairs more slowly lately, or that you had a restless night waking up short of breath but didn't mention it. Many vague symptoms get attributed to anxiety, digestion problems, or simply aging, so patients leave feeling reassured only to face a heart attack days later. The problem isn't that doctors miss something, it's that the information you bring them isn't enough to form a complete picture. Your blood pressure might look fine in the office, but may have spiked the morning before. Your heart rate might be normal during the visit, but unusually high at night. If these details aren't recorded, your doctor has no way of knowing. The solution is to become the record keeper of your own body's story. Write just a few lines each day. When the symptom happened, what it felt like, what you were doing at the time, and whether it happened again. After a week, you'll start seeing clear patterns. When you hand this to your doctor, you're no longer a vague case. You're providing targeted data to help them make a more accurate diagnosis. But there's one thing I need you to remember. Even with the perfect symptom log, there are moments that leave no room for waiting or analysis. When your body sends a strong signal, a dull ache in the chest, sudden shortness of breath, cold sweat down your back, or an unshakable sense that something is wrong, that's the time to act immediately. Not to Google it, not to wait and see, but to move. In the next section, I'll tell you about the one action, small as it seems, that could decide whether you survive the first critical minutes of a heart attack. The life or death action. When your body speaks up with a dull ache, shortness of breath, unusual cold sweats, or an unshakable sense that something is wrong, that moment is not for hesitation. The biggest mistake I've seen in many patients is trying to endure it or reassuring themselves it's probably nothing. Some believe they'll be fine if they just wait a few minutes, or worse, they try to drive themselves to the hospital. But a heart attack doesn't wait until you're ready. It doesn't care that you want to finish a task, wait for your kids to get home, or find a good reason to call for help. The only thing you should do when you sense something is wrong with your heart is call 911. You don't need to be certain it's a heart attack to make that call. If you clearly feel something unusual and your gut tells you it's serious, that's enough. An ambulance doesn't just take you to the hospital. It brings medication, life support equipment, and trained professionals who know exactly what to do when every second matters. In many cases, treatment within those first few minutes is the difference between life and death. I know some people feel embarrassed to cause a fuss, worry about bothering their family, or feel being seen as overly anxious. But remember, you're not inconveniencing anyone when you're saving your own life. Calling 911 isn't a sign of weakness. It's one of the smartest and most courageous actions you can take for yourself and for the people you love. Studies show that patients treated on the spot by emergency medical staff have far higher survival rates than those who try to get to the hospital on their own. And when you survive, the story doesn't end. That's not the moment to breathe a sigh of relief and return to old habits. It's your chance to rewrite how you'll live the rest of your life.
Life after survival. Surviving a heart attack isn't the end. It's a powerful reminder that you still have time to choose how you'll live. Many people slow down after such an event, becoming overly cautious or even withdrawing out of fear of another attack. But the truth is, you don't have to live in constant worry. What you need is the right direction.
I've seen patients start each day with a glass of warm water, take a 15-minute walk, add 1 extra serving of vegetables, go to bed 30 minutes earlier, and practice deep breathing when stressed. None of them became athletes, but they grew healthier, more energetic, and more confident in their bodies. You don't need to change everything overnight. Just start with one small action you can sustain. It might be cutting back on salt at dinner, scheduling regular checkups, or jotting down any unusual sensations you notice. Small actions, repeated long enough, will gradually rebuild your heart, like laying brick after brick to create a strong foundation. The key isn't perfection, it's being proactive. Proactively choose better foods. Proactively move your body every day. Proactively share your observations with your doctor instead of waiting until things get severe. After 50, health is no longer a matter of luck, it's a matter of choice. And even after a heart attack, you still have many choices left in your hands. We all have a reason to live: family, a life partner, unfinished dreams, or simply the desire to see tomorrow's sunrise. All of that is only possible if your heart stays healthy. Don't wait for it to hurt before you start caring. Pay attention while it's still beating steadily each day. Detecting a heart attack before it happens isn't far-fetched. It starts with paying a little more attention, taking those small warning signs seriously instead of brushing them off. If you've made it this far, I believe you're ready to do just that. Choose one small thing from what you've just heard and start today. Take your blood pressure, write down that unusual feeling you just remembered, or book the doctor's appointment you've been putting off for too long. One small change could protect the biggest things in your life. And if this video has helped you better understand your body, hit like so I know you're still with me. Subscribe so you won't miss the next important message, and share this with someone you care about, because sometimes the right information at the right time can save an entire life.